On today's World Insight, the WHO declares COVID a public health emergency at an inflection point. Does this mean we can relax? We speak to WHO spokesperson Margaret Harris to find out.
Hello and welcome to World Insight with me, Tian Wei. The World Health Organization on Monday said that the ongoing COVID-19 pandemic continues to constitute a public health emergency of international concern. It's the highest form of alert. Acknowledging the COVID-19 pandemic is likely in a transition point, the WHO said the world is in a better place than it was a year ago when its Omicron wave was at its peak. But they aired concerns about the ongoing high number of deaths and low vaccine uptake in low and middle-income countries, as well as uncertainty regarding emergency subvariants. China recently announced that the overall of COVID-19 infections during the Spring Festival has been low and that cases were in steady decline across the country. So what are the challenges and the opportunities brought about through living with COVID? Here is my in-depth interview with Dr. Margaret Harris, WHO spokesperson. About the latest statement made by the World Health Organization about COVID-19 remains an emergency. However, we are seeing countries are making their different approaches to this global health emergency. What does that mean?
So the decision that was made, or the advice that was given to us by this independent emergency committee, was for the world. It's global advice, and it says this is where the global situation is, and the global situation does remain a public health emergency of international concern. But we do recognize that different countries are at different stages or have different situations in their own communities. So no country will be exactly at the same point. But this was a characterization of where we are as the world.
Transition, of course, is another key word I pay attention to in the statement put out by the WHO. How is that going to be defined? Is it going to be, let's play it by ear, let's see how things evolve, or there are specific official descriptions about transition, for example, with previous cases of different diseases that we can use as reference?
That's really an excellent question. So there are not official laid down criteria. And one of the reasons for that is that every public health emergency of international concern we've had has been very different. And this certainly is completely different from many of the other ones. The other ones have been things like Ebola, have been the Zika virus, the complications of Zika virus had been, so we've had quite different ways in which a transition has occurred. For instance, for Ebola, it's quite often after all cases are finished and there were clear criteria. But for other diseases, the criteria were not set hard and fast. So again, that's why each of our emergency committees that advise us on this are all made of different people. They're not the same committee. There are people with that kind of expertise who can say, now, this is where we are now. This is why we think, looking at the global data, that we're moving into this phase. And that's the advice they give the Director General, Dr. Tedros. And he is actually the one in the end who says, okay, yes or no.
Well, you're putting a lot of responsibilities on the shoulder of the Director General by that statement, I guess. Yeah, that's part of his job, isn't it?
He's got broad shoulders.
Now, I'm sure, Dr. Harris, you have also been hearing from the Chinese side stating that the current wave of COVID-19 is, quote unquote, coming to an end. Now, how is WHO, your organization, looking at these different statements and approaches by countries of WHO, member countries of WHO?
The numbers coming out of China suggest that now the surge is passing. That's very good news. especially for the Chinese people, so that they can at least enjoy the time together during the Spring Festival. But it doesn't mean that you say it's over. It means that you still must be vigilant. You still must be watching what happens next. This is an unstable virus. It keeps on tricking us. So we all have to really remain vigilant.
Now, we know that in different parts of the world, there are still different subvariants active. Are you worried as an organization, WHO, about the further spread of different subvariants as a result of people's more frequent travel?
Well, we always worry about subvariants. That's part of our job, is to worry about subvariants. We are tracking more than 500 subvariants of Omicron right now, and we've got 6 that are on the higher watch list. And we really, one of the things we are most worried about is actually that countries around the world are not doing the genetic sequencing that they were doing, say, 6 months ago, a year ago. We're seeing far fewer sequences submitted. So in other words, we're getting blinder and blinder about what's out there. We need more testing to be done, more submission of the genetic sequences of that testing, so that we can really understand, is there a new variant that's going to come along like Omicron did a year ago and cause the same problems? We need to know that so that you can learn that as quickly as possible and take the appropriate precautions.
There is, though, something called COVID fatigue, as you may have noticed, and of course the economic prospect that people's lives depend on. So what do you make as a spokesperson of the WHO of this phenomenon, and how do you see it's having an impact on the future vigilance and also availability of information?
I think that's one of the biggest challenges we face, actually. And indeed, you're right. People in much of the world suddenly decided, it seemed to be like last summer, that COVID no longer was there. It was extraordinary. I mean, we're seeing bigger numbers now. We're seeing, tragically, we've seen 170,000 people die in the last 8 weeks. I can't think of anything in my lifetime that has killed so many people so quickly. And yet you had large parts of the world somehow deciding, not a problem anymore. I really don't know how someone who thinks that can look in the eyes of somebody who's just lost a relative, a loved one, to COVID-19. But so indeed, and again, there's been this massive misinformation, torrent of misinformation that's become more and more difficult, more and more sort of disparity of opinion, and even the things that have saved so many lives, the vaccines, saved millions of lives, even they have come under attack, that providing a vaccine, something that will keep you out of hospital, that will save your life, there are groups in the world, there are people in the world who think that somehow offering you a vaccine, they behave as if that's a bad thing. That's it. To me, it's very difficult to get my head around that when you've got people who work together. I mean, the scientific community all around the world, every country, work together transparently to get these things, make them available. We've got more COVID-19 vaccines available than I think we've had a vaccine available for anything else in a much shorter time. And they really have saved millions and millions of lives. And yet you have people saying that this is not a good thing. I find this extraordinary. And we at WHO have actually developed a large team that works on, they're called the infodemiology team. And their job is to listen to all the information noises, the ideas out there, and to try to bring some coherence to the message from people like me to the world. But indeed, it has been and remains a struggle.
Is that struggle even bigger than COVID-19, the disease itself?
Well, I think anybody who's
some might wonder.
Well, it's if you were looking in sort of large terms, it has certainly killed people, and I wouldn't be able to quantify how many people it has killed compared with the disease itself. But the misinformation has certainly killed people all around the world. And this is it's just a tragedy. It's such a waste of lives when people have refused a vaccine because they were told it was a bad thing, and as they lie dying in hospital are still saying that the vaccine's worse than the disease.
Regarding what we have learned, international cooperation is always the key, Dr. Harris. You know this better than probably all of us. Now, COVAX is a platform organized and supported by the international community. China also contributed as well. How far do you see COVAX has managed to help us to going through the waves of COVID-19, especially for emerging and developing countries?
Certainly, throughout the pandemic, Chinese scientists, Chinese experts have been critical, especially in the way in which when they have shared information. So I'm thinking of February 2020. I remember sitting in the very first meeting of all the scientists to get together to work out what were the most high priority things we needed to do. And there were the scientists and the medical experts and the people fighting COVID-19 in China who joined that meeting, what was in what was the middle of the night in China, because this meeting was held in Geneva during the day, and provided very clear, very helpful, very frank information about what they were dealing with. And that enabled people to get on with the job as quickly as possible. The other important thing is that the sequence of SARS-CoV-2, this virus, was shared very, very early on. That's unprecedented. It was shared within a few weeks of knowing that this threat was out there. We didn't know what it was. We didn't know much about it, but the virus was identified and the sequence was shared. That meant the vaccine developers could start work from that moment on. And I think it was shared January 10, January 11, very, very early on. That, to me, is a landmark moment in history. There've been lots of nasty stuff said between all sorts of countries and other countries. Some of that's stimulated by fear. That's, when people are threatened, they hit out at others. But I do believe that in the wash, the great things that people have done will be the things that we remember. But let's take it forward and apply them.
It seems that we all have to be, during the whole process, be vigilant, be observant, be a good student, as the situations are always changing, and there could be better practices in different parts of the world. Now, Dr. Harris, about that, what have WHO learned, and what do you see the international community could learn?
I couldn't have said it better than you just said it, that indeed. Being vigilant, being aware of what good health takes. Now, it doesn't have to be hard and horrible, but we've not been vigilant. We've almost been like people at a smorgasbord. We've damaged our environment. We've been greedy. We've been lazy. And I'm talking about we as humans. Now, we at WHO as an organization have to be learn again that we have to be constantly vigilant, that we have to be working with our partners at all time to ensure that, as I mentioned before, that the information is coming in at all times, that we're sharing information, that we can be as quick as possible, but also as accurate as possible and as effective as possible.
You're watching World Insight. Still to come, my discussion with WHO spokesperson. We focus on COVID-19 and what we have learned and how we will be better prepared for future pandemics. Next. Welcome back. You're still watching World Insight with me, Tian Wei. This This is the interview with Dr. Margaret Harris. I spoke to her recently. She's the spokesperson of WHO. So what are the lessons we should learn while dealing with COVID-19? And how can we be prepared better for the future? Here's my interview with her again. Looking at the future, immediate future, shall I say, how much proportion of the resources, the time and the energy of the World Health Organization will be devoted to the prevention and control of COVID-19, which is being still declared as a global health emergency, vis-a-vis other diseases and health emergencies that might pop up?
That's a very good question. We certainly have got a large number of people working on it, but we don't only work on COVID-19 even now. So even though a huge amount of our time and energy is spent on the work for COVID-19, I can tell you, for instance, our clinical lead, the person who leads all our efforts to get therapeutics and people into hospital care, also works on Ebola, also works on cholera, also works on all sorts of other things, because that's our job. Our job is to help every human attain the highest level of health. So as COVID ideally transitions from an emergency, yes, we will probably have fewer people dedicated to it, but I expect that we will, or those of us who are dedicated to COVID but also work on everything else, may have a little bit more space for many of the other things as well.
There were warnings earlier given by various parties that are been dealing with COVID-19, suggesting we haven't learned yet the lessons of a global pandemic from many different aspects. Now, from your perspective, how much have we learned? How much do you see we would have been able to, as a world, be able to have concerted efforts to deal with future emergencies?
Well, what I've seen, and I mentioned before, is that certainly the scientific community, regardless of who and where they are, can work very well together, very transparently, very quickly to produce life-saving therapies and preventive treatment. So we know that we can do that. But I am seeing, I think we're all seeing, that the world forgets very quickly and moves on. It seems to have a very, very short attention span. And that's the lesson we have to learn, that it's not during the crisis, as I mentioned before, it's before the crisis. It's the stuff nobody pays any attention to, nobody does any news reports on, like identifying a virus. You know, every day I just like, we have a meeting every morning and we have a team that goes through signals from around the world. And this morning they had mentioned that they'd gone through 6,000 different alerts to identify whether or not there was anything that we should be anxious about. From those, they'd identified 7, and then they raised 3. Now, we do that every morning, but we rely on those alerts coming from around the world. You know, we can't just make it up. And so while that information is coming into us, we can do something about it. But if the world forgets, if the world doesn't tell us what's going on or doesn't give us that information daily, we can't do what we need to do, which is find the ones that are going to cause trouble and stop them early.
Is there a way that you can rally more of these awareness from members of yours?
One of the ways we're looking at is the pandemic treaty. So the pandemic treaty, which is being discussed right now in our executive committee, and we will have a further meeting on that at the end of February, after which a zero draft will be produced. That is one way where you get agreement from countries around the world that they really will do these things. But I would say also you need the community to be committed to this, to be holding those who have to do the who should be doing this to account. So in other words, saying, yeah, so what are we doing on this? Are we doing the things we need to do to protect ourselves? Are we doing things like looking at our agricultural practices to ensure that the spillover from animals to humans isn't happening nearly as often as it is now? And this is happening around the world again. We're seeing where you've got intensive farming practices, you've got a much higher rate of pathogens that could be very, what we call high threat pathogens, pathogens that can jump into the human population and cause problems. So there's a lot we all have to look at everywhere in the world to protect ourselves as humans, because these things are going to keep on coming. And we, I'm at the end of my life, but I've got grandchildren. I want them to live in a much better world.
And they want you to also live in a healthy way for your, when you are celebrating life.
Exactly. We all should be, having gone through what we've gone through in the last 3 years, there should be something we can say, look, we learned from this, we changed the world. We made a difference rather than we walked away and forgot about it. Let's take this year and make it maybe the best year of all our lives, because we really did make a difference.
I see you're in a celebratory mood already.
Well, it's a time of year when you reflect on what's gone on and you reflect on what you're going to do. And I always think, let's do something better.
You earlier mentioned about the 6 subvariants that WHO is watching very closely, even about Omicron itself, not to mention other variants of COVID. What are these 6 ones that you are watching closely, if you can be more specific?
So they are various subvariants of Omicron, and they're daughters and sons of Omicron. Some of them are daughters and sons that actually married. So the ones you call the recombinants, and the one that you may have heard most recently is XBB 0.1.5. And there are 2 in the XBB group that we are watching because they are recombinants. As I said, they're as if a daughter and son of Omicron got married, and they combined their power and their strength.
In other words, more infectious, and could be more infectious, could be more fatal.
Well, we look at them to see if that's the case. So at the moment, we're not seeing that any of them are causing more severe disease. There was some concern about XBB because it was replacing other variants, other forms of COVID-19 very quickly in the United States, particularly in the East Coast, in a part of the United States. So we were getting a lot of sequences, and it seemed to be replacing. It had what you call a growth advantage. But that suggested that it was more transmissible, but there wasn't clear enough evidence to say whether or not we would raise the alarm further. So currently they are still under monitoring, but again, when you've got so much of a virus around the world, you've seen this enormous surge that you've just seen in China. The virus has a much more opportunity to create variants, particularly in people who are ill for a long time. So the more people are infected, the more likely you are to have variants. So again, that's why we say we really, really need to see the sequences. So if we see the sequences, we understand there's a variant, we look at what that variant did in the population, and that tells us whether we've got something that's new and more dangerous. At the moment, everything's just under monitoring. We haven't got something that's newer and more dangerous right now.
What is the biggest concern for WHO now?
Goodness. I think we need to be aware that this won't be the last one. As I said before, we must be vigilant, but also we have to look at all the other conditions. The things that cause most problems for us as most humans are actually non-communicable diseases. And so this is things like obesity, high blood pressure, all the things related to diets, the inability to get exercise, things like road traffic accidents. When you look at what kills children most globally, it's road traffic accidents. So we have to look at much, much more. And for we as WHO, again, this is why it's critical that we can work well with governments and authorities, because they often make the decisions that change things, that make it easier for individuals to have health. But we also work very much, or want to work better, with communities, because it's actually every person who holds their health in their hands. And if your means of maintaining or improving your health isn't available, agitate for it. Find a way to change that.
Related to that, I noticed the WHO has updated your list of medicines that should be stockpiled for so-called radiological and nuclear emergencies. What does that mean for everyone in the world?
So that was actually ongoing work that's been, the first version was published, I think, around 2007, and obviously it needed to be updated to look at what kind of medicines would be most effective, because we've had quite a number of radiological and emergencies such as Fukushima, and we've got various ways and means in which a radiological emergency could occur. And what's really important when you have such an emergency, so this work that we've just published actually began quite a few years ago, I think back 2000, at least 2 or 3 years ago. But the important thing is that governments actually stockpile these medicines, because if you do have such an emergency, you need to be able to get access to them very quickly in order to prevent any harms from an escape of nuclear radionuclides.
Do you see there is a special, there should be more special attention being paid at this moment on the issue, or this is the same level as earlier? I just want to make sure I understand right.
Well, really, it's the same level as earlier. The point of this is to provide really policymakers and pharmacists and hospitals with the advice about how to manage it, because the problem is, it's again, like I was saying, like housework. Most of the time you don't need it, but when you do need it, you need it right away. So you need to be sure that you do have the medicines, you can get them quickly to where you need them. So that was the purpose. Otherwise, there's no point in having the medicines unless you can get them to the people who will benefit from them quickly. So this policy we've just published is to give governments and health authorities the advice about how to get them and where to have them and what to have in order to be able to use them effectively.
Dr. Harris, always a pleasure. Thank you so much.
Great pleasure to be with you, Wei.
Dr. Margaret Harris, WHO spokesperson. That's all the time we have for today. If you'd like to know more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of my team, thanks for being with us. Bye for now.